We are here at the Elevating Brain Health Conference with Dr. Yousef. You gave a very deep dive into the impact of dementia, and one of the big takeaways was how big of an effect insulin resistance has. So for people at home, how might they know if they have insulin resistance or if they're on the path to insulin resistance?
Yeah, I think that's a great question. And I think one of the scary things about insulin resistance is that there was a study on these young men in their 20s that were not overweight that actually ended up when they tested them for insulin resistance, they found out that they actually have 40% of them had insulin resistance. So, and not overweight, you would have never guessed it. And I think that there are signs, like if that somebody would have insulin resistance. For example, difficulty losing weight despite like trying to diet and exercise. Having skin tags, a lot of people don't know it, but those little skin tags could actually be insulin resistance. Sometimes when you get like darker skin on the back of your neck or on the back of the arms, that's kind of a sign of insulin resistance. But really the way to do it is test it. So you're going to want to check an insulin, a C-peptide, and then you can a glucose level, and you can from that calculate what's called a HOMA-IR score, so you can do the calculation. And then some labs actually have like Quest would have an insulin resistance score that they can do to see if there's insulin resistance. So that's really, for me, that's like the way to go about checking for insulin resistance.